my name is Paula, and today my group and I will be talking to you a little bit about the importance of health literacy in healthcare. To begin with, it might be helpful to define health literacy. There are two categories of health literacy: personal health literacy and organizational health literacy. Personal health literacy is an individual's ability to understand the medical information you're giving to them. This could be medical materials, health-related materials, and how they could use different resources to get more information to understand their medical decisions and diagnoses. In America, the average reading level is a 7th to 8th grade level, so that takes its toll on health literacy. Also, there is different language understanding, so if somebody doesn't speak English very well, it might be more difficult for them to understand the health material you're giving them. And then there's just the general familiarity that an individual might have with the healthcare system and how to navigate the healthcare system. The second type of health literacy is organizational health literacy, and this is an organization's effort or their ability to create health materials that are accessible across a broad spectrum of people and across a large level of health literacy levels. This can include something like translating your materials into multiple languages for non-native English speakers. It can be making sure that your website and any material that you provide is accessible for individuals who might have different reading or sight or hearing impairments. And it can be something as simple as including visual aids or diagrams and making sure to use plain language whenever you create educational materials for your patients.
Alright, so this next topic addresses the importance of health literacy for adults with intellectual and developmental disabilities, and the first thing that I want to touch on is a direct quote taken from the assigned article on health literacy that states that for individuals with IDD, adapting health materials and simple language visuals and step-by-step instructions improves outcomes, comprehension, and engagement in their care. Health literacy is going to allow patients to be able to participate in their healthcare decisions as well as have a proper understanding of the situation so that they will be able to provide proper consent. This will also allow them to establish general comprehension of their own health, which we all know is very important. Transparency about a patient's health and ensuring literacy also is going to promote independence for patients. On the other hand, however, it is going to allow for communications between healthcare provider and patient, so this is going to improve the patient-provider relationship. Additionally, providing health literacy will help ensure that patients feel empowered, respected, and that they will trust their provider. If a patient understands their health and the path of care, they will be more likely to follow the plan and see improvement in their circumstances. So this is ultimately going to lead to better adherence to the treatment. Ultimately, health literacy is going to provide both patient and provider with an enhanced experience and better outcomes. So this is just some few ways that are going to explain why it's so important, and you can see that there is a bunch of different ways that this is going to improve experiences, not just kind of something that's super cut and dry. So that is that.
It opens up communication to try and help educate the patient. Tufts has a whole website full of different literacy exams and tests. It's from function, media literacy, and there's even communication. The new Vital Sign was made by Pfizer and is a great way to look at each person's health literacy. It's a small test in the form of almost nutrition facts on like the back of an ice cream cone, and it allows the patient to explain what they're looking at and what the health facts know. One of the best new ways to teach method is to use a teach-back method for individuals with IDD. The healthcare person will teach it to the individual, and the individual will teach it back, and it opens up conversation about what they know and what they possibly don't know. This is a picture of it right here. As you can see, the patient will check off different words they know, what they insinuate with it, and
Okay, now we are going to consider the legal and ethical responsibilities to ensure health literacy for adults with IDD. This is the big guns part of the PowerPoint presentation, and it's a very important concept of health literacy and why it should be very important to you. So there are some legal and ethical responsibilities that we as future healthcare providers need to make sure adults with IDD understand their healthcare. Some very big points in this is there's ethical reasons. So it's our duty to hold our fiduciary duty to our patients. And I know what you're thinking, what does fiduciary mean? I also wasn't sure. It's just a big word for saying that this is our duty to hold our patient's best interest at hand. If our patient does not understand the treatment options we're going through with them, then how can we say that we have their best interest? We haven't fully done our job at explaining and keeping the patient as front and center. Next, there could be violation of patient autonomy. If a procedure was not explained well, they could think one part of their body is going to be examined, and they could consent to that piece of their body to be examined. But due to poor communication, a different part of the body could be looked at that the patient did not consent to. So then these misfortunes can lead to damaging of the doctor-patient relationship. The patient might not trust the provider anymore, and in turn have to start the whole process again by going to another clinic and starting from square one. Next, there are some legal implications. As future providers, we could be setting ourselves up to the possibility of a lawsuit for malpractice or negligence because the patient did not consent to something that they understood. They could think they were agreeing to get their arm x-ray, but due to poor explanation, they were going to get their back MRI'd. So this could be setting ourselves up to lawsuits and malpractice. So the patient did not consent to that procedure and thus opens the door to more lawsuits. With this, patients' rights could be violated by having their HIPAA exposed would be one example. This goes against the law. Next, a procedure being performed without formal consent could be considered assault. If you didn't get the formal consent, then they never agreed to do it. So this could mean forms were not signed, or the procedure was never explained to the patient. They were just given a form and told to sign it quickly without allowing them time to read it over and ask any questions they might have. This could be considered assault as the patient signed the consent under duress.
Now that we have covered the basics of health literacy and why it's important for health providers to consider, let's jump into some additional questions.
Another question we have is, how do we actually prevent students and providers from making the mistake of talking to the caregiver rather than the patient with disabilities, therefore the patient isn't excluded in their care? So we as providers can make sure that the patient is the main focus of the appointment. We can do this by having the patient seated on the exam table while having the caregiver sitting in a chair not right next to the patient. That way we can make sure to be making eye contact with the patient the entire time and not making side glances to the caregiver. Next, language that we use is also important because in the initial greeting we can avoid using the patient's first name and refer to them in first person. So that way we're not talking about them, but we're talking to them. We could also politely ask the caregiver to let the patient talk if they keep trying to chime in. So that way the patient isn't getting taken over by their caregiver. We need to make sure to introduce ourselves first to the patient, then we can ask them who their support person is to them. Who did you bring in with you today? That way we're giving the patient back their autonomy.
How many individuals with IDD receive health care, get stereotyped on average? Do you believe that there is a way to lower the amount of stereotypes that come about in the healthcare field and working with individuals with IDD? If so, how? If not, why not? According to Lazzoni et al., 40.7% of physicians were very confident about their ability to provide equal quality care to patients with a disability, while just 56.5% strongly agreed they welcome disabled patients into their practices, and only 18.1% strongly agree that the healthcare system often treats these patients unfairly. With this in mind, we can confidently say that there are a significant amount of patients with IDD who are stereotyped. To help reduce this, we can expose more healthcare providers to differently abled persons, extend appointment times, improve accessibility of health materials, and provide additional support to patients with IDD.
Thank you so much for watching our presentation. If you're interested in learning more about health literacy, we've included a couple of additional resources on this slide that you can go ahead and reference when you have time. Thank you so much.